There was quite a lot of good news about COVID-19 recently, but some people have been pointing towards quite a scary statistic, certainly scary on the surface. And it comes in this table from Public Health England, looking at who's got the Delta variant and what's happened to them later on. And I'll just circle it. You can see it there. Look, of those who've received 2 doses of the vaccination, 224 died. In fact, actually, if you look across those who have been vaccinated, 1 or 2 doses, the majority of those deaths were people who were vaccinated, which raises a question. Are the vaccines working? What's going wrong here?
All right, guys, Rukshan here, and just going to pause that video there. So that was the video from today from the UK, from Sky News. And they're talking about the rate of people who are dying who are vaccinated in the country, and obviously offering an explanation for what's going on. I'll play the rest of that video at the end of my video. But what I wanted to discuss is, for us being in Australia, one of the benefits right now is that we can almost peer into our future and see where things will be in the next 6-7 months as, the rollouts in this country progress, and kind of figure out how the government will change their messaging around vaccination. And in particular, one of my main focuses is how the media approaches these issues. Now, in America today, there's a word, a phrase that's being said a lot across the entire country, which I picked up on just from watching some of the news coverage. And that word, that term, is breakthrough cases. So breakthrough cases. It's not really a term that we've heard in Australia yet at all, but I'm sure Norman Swan and the rest of our experts in this country are going to be bringing out this word, this term very, very soon. So I want you guys to remember breakthrough cases. And I'm going to show you a compilation of them discussing breakthrough cases. And essentially what they are is people who are fully vaccinated, obviously getting infected with COVID, whether it's a reinfection or a new infection. Now, the importance behind this is that this messaging change, this change in narrative, is coinciding with the reimposition of certain restrictions in the United States. So you can see how these two things kind of go, together like peas in a pod. You have these new terms of reference or new ways of describing these infections that are occurring amongst those who are fully vaccinated, and the reintroduction of different types of restrictions. I'm going to play the compilation now.
Some of you are wondering about breakthrough cases. That's when someone is fully vaccinated but tests positive.
You spoke to 2 people who are breakthrough cases.
Yeah, and they were somewhat surprised to test positive for COVID after an outbreak at the summer camp where they work. We've always known that the vaccines aren't perfect and some breakthrough is bound to happen. But that's part of why the CDC is changing course on mask recommendations.
One of the major points from the experts on this tonight is that breakthrough cases are going to happen. They are expected, but still very, very rare.
Breakthrough cases among those fully vaccinated people are rare.
But today, we found out a couple of prominent members of our community have tested positive for the virus despite already receiving their shots.
Tonight, we're learning about what is being called a breakthrough case of the Delta variant at the Colorado Springs Bridge Center. Bridge as in playing cards. A breakthrough case means the person who tested positive is fully vaccinated.
People who have been fully vaccinated are among the cases found in the area. So it begs the question, what does the vaccine protect against?
The state public health is reporting almost 600 breakthrough cases and some outbreaks at long-term care facilities. One of those is Amber Glen Alzheimer's Special Care Center in Urbana. The administrator there tells me they have 4 active cases. 3 of those are people who are vaccinated.
A small part of Americans are experiencing breakthrough infections of coronavirus, which is when a fully vaccinated person tests positive for COVID-19.
We are getting firsthand account of what it's like of one of these so-called breakthrough infections.
Fox 5's Evan Lambert spoke with 2 fully vaccinated people who recently tested positive.
Well, there you go. Breakthrough cases. And that's just a sampling of the media from the United States from today. This is not from different points of, the week or something. Just one day today. From all over the country, like all the different regions of the US. Now there's much, much more, but I've just given a small sampling. And as you can see, there's this whole narrative being built now around breakthrough cases. And it's a way to explain to a population that is more vaccinated than we are in Australia, right? So there's a lot more people in the UK and in America who are vaccinated. But in the hospitals now, you're seeing people fully vaccinated succumbing to the virus. And, how do you explain that then to the audience? And I think this is one of the ways that they're starting this process of explaining, this new thing. Because I think a lot of people, especially in this country, if you listen to our politicians today speaking, Scott Morrison and Gladys and Daniel Andrews, when they're speaking about vaccination, sometimes they speak in absolute terms. So, this is our way out, and this will change this, and this will change that, and you have to go get the vaccine. But what they're not telling you is that experts here in Australia, our scientists and people at ATAGI and even the premiers themselves and the Prime Minister have access to all this international data, and they already know that in those countries, even though they're fully vaccinated, they're still facing certain problems where they might have to reimpose restrictions. So in America, what are those restrictions that are being reimposed? Well, one of them is that even if you're fully vaccinated, you have to wear masks indoors. And this is not for areas where it might be people there's more people that are unvaccinated. No, this is across the board in some states. So think about it. If you're associating freedom with the number of people in this nation who are going to have the first and second jab right now for this current variant, you have countries far along the path in like the US and the UK who are now reintroducing restrictions based on these new strains like the Delta variant. So this is just a compilation of the change in the mask rules in the US today.
And right now, the CDC is expected to recommend that some vaccinated people mask up yet again.
CDC officials said the reason for the change, new data that shows vaccinated people on rare occasions can spread the Delta variant. Also troubling, in some instances, they carried the same viral load as an unvaccinated person.
The guidance recommends that masks be worn inside where COVID transmission is considered high. The recommendation includes everyone, even people who are fully vaccinated.
It's going to sound very confusing, but the new guidance is for fully vaccinated Americans in this country. They're now saying that you should put the masks back on when you're out in public and going indoors.
Hey, David, the CDC is updating its mask guidance given new information about how transmissible the Delta variant is, now recommending that in areas of high transmission, that people, even who are fully vaccinated, wear masks in public settings indoors.
We're not saying that wearing a mask is convenient or people feel like it, but we are telling you that that is the way to protect yourself, protect your loved ones, and that's why the CDC is issuing this guidance.
Even if you're fully vaccinated, you can then shed the virus and transmit the virus to others.
All right, so obviously reintroduction of mask mandates in the United States, and it's up to the different states in that country to enforce these rules, but this is the recommended guidance from the CDC. So, if you're seeing, when you're watching our chief health officers being questioned about masks, like Brett Sutton was a few days ago, he kind of gave it away that masks might be here to stay for a long, long time. And this is partly one of the reasons. They already know that for them, the implementation of the next phase, which is this third dose, this third jab, which is what a lot of the discussion in America is right now, is about, do we need to give the vaccinated another jab to, make that coverage that they receive from the two jabs more absolute, because it seems like it's not enough with this Delta variant. So they've reintroduced these mask mandates as a precursor to people being told you might need to go get another jab. Interesting times indeed, and you can really see how maybe our leaders aren't being fully honest with us in terms of what our progression will be, because a lot of the time what happens in Australia does follow the path of what happens in the UK and the US. This is an interesting snippet that I got from an explanation from a doctor in America talking to a newsreader.
The cluster of cases that are coming up, and a lot of that are breakthrough cases. So some people might say, okay, well, clearly the vaccine is not working if people are still getting infected with COVID. What do you say to that?
Well, I would say a couple of things. The first is nothing is 100%. We know that the vaccine was not 100% effective. It was 94% effective. So we expect some cases. The second is as the infection in the community goes up, the number of breakthrough cases is likely to go up. But the third and most important, I think, is that even if people get these cases, they're not ending up in the hospital. They're mild illnesses, which is what we wanted to do with the vaccine. Natasha, I like to compare it to a seatbelt. So seatbelts work to reduce your risk of dying dramatically, but it doesn't guarantee that you can't have a fatal injury in a car accident.
That's a great analogy. And
Yes, that is a great analogy. So, vaccines are all of a sudden they've become the seatbelt, so it can't really guarantee anything. You can still have a fatal incident. But at the same time, she's also saying that these breakthrough cases don't really have any serious implications, which is interesting for the US media to be talking this way. And I think a lot of that has to do with, in America, they kind of downplay these things in the media to avoid vaccine hesitancy. But I've noticed in the UK, the way they talk about this is a bit more different. And, that clip that I started with at the start, I'm going to finish that off now with the information that bloke gives. So listen to this, and thank you for watching this video.
There was quite a lot of good news about COVID-19 recently, but some people have been pointing towards quite a scary statistic, certainly scary on the surface. And it comes in this table from Public Health England, looking at who's got the Delta variant and what's happened to them later on. And I'll just circle it. You can see it there. Look, of those who've received 2 doses of the vaccination, 224 died. In fact, actually, if you look across those who have been vaccinated, 1 or 2 doses, the majority of those deaths were people who were vaccinated, which raises a question. Are the vaccines working? What's going wrong here? Well, it's worth just bearing in mind 2 things here, because actually these numbers aren't quite as scary as they look at first. The first thing is that even though these vaccines should reduce the risk of death, they don't eliminate it. Now, these bars here show you your mortality risk, so the risk of getting the disease and dying by age group, from youngest to oldest. And you can see, obviously, the oldest, that 90-year-old group, is very high indeed. I'll just put that into a logarithmic scale so you can see the bottom end as well. And let's just kind of go through this. So 90-year-olds up there, pre-vaccination. 60-year-olds, for instance, pre-vaccination are down there. But if we reduce those bars in line with what those pharmaceutical companies say they should be reduced by, that they go down, the risk of dying across the piece goes down. But even so, even if they're working supposedly as they should do, the risk for a 90-year-old is still in line with a 60-year-old pre-vaccination. So it's not eliminating it, but it is reducing it. Second thing is this. Just look at how many people have been vaccinated of that pool that we're talking about. So these are people who got Delta. You can see that about 85% or so were vaccinated. So that's most of your sample pool. And then when you look at other things like hospitalizations, those blue bars, the blue bit of the bar is bigger than the red bit. But now break it down. Look at how many of those people who were vaccinated went on to hospital. It's about 3.5%. Now look at how much of the red bit, so those who are unvaccinated, were hospitalized, 8.4%. You see, there's a difference, a kind of difference in likelihood. 2.4 times more hospitalizations per case among those who are unvaccinated, and yet the sheer number of those who are hospitalized having been vaccinated is higher. Similar thing when we look at deaths as well. So the same thing again, we start with total number of cases, then we look at the number of deaths, and then we look at how many deaths per case. And for vaccinated people, it's 2% of those who were tested positive for Delta went on to die. For unvaccinated, it's 5.6% of those who got the disease went on to die. So a higher proportion again, 2.8 times more deaths per case. And yet the sheer number of those who are vaccinated who went on to die was greater than the number who were unvaccinated. Just underlines that simple numbers on their own don't tell the full story.